Hi everyone, my name is Britt Fallon. I'm the beauty director at New Beauty Magazine, and we are going live for another episode of New Beauty Talks. This time I'm going to be joined by board certified plastic surgeon Dr. William Lau, who's based in New York City. We're going to be talking about all things breast augmentation, which is a huge topic of conversation in our new beauty community. We are always being asked questions about this topic, and Dr. Lau is definitely a board certified expert in the subject. So we are going to be joined by him in just a second, and we'll get going. Thank you all for joining us today. Happy Friday. And here we go. Just waiting for him to connect now. There we go. Hello.
Hello. Hey, Brittany.
How are you?
Good, good. First time doing the Instagram live, so I'm trying to figure out how to use it still. Yeah.
Are you in the office?
Yeah, I'm in the office. I just finished surgery, so sorry my hair is a little bit messy. Yeah.
The life of a surgeon, right?
Yeah.
Well, thank you for joining me. I just was greeting our audience and letting them know that we're going to be talking about breast augmentation today. I introduced you, but I'd love for everyone who's joining in now, if you could tell them again, reintroduce yourself and tell them kind of a little bit about yourself and your practice.
Yeah, sure. Thank you. So first of all, thank you for having me. It's a pleasure to talk to everyone on Friday. I think hopefully it's be a casual talk, so everyone can learn a little bit about breast augmentation. Well, my name is William, and then last name Lau. I grew up in Taiwan, which is, a small island in Asia. And then I studied high school in Canada, Vancouver, Canada. And I came to US for undergrad, medical school, residency, went to medical school at Johns Hopkins in Baltimore. And I did a plastic surgery residency. I'm a board certified plastic surgeon, and did a cosmetic surgery fellowship in New York. And I worked because my family was in Asia, so I worked a few years in Asia actually, and then came back to US and started my own private practice in New York a few years ago. So I guess I'm kind of cool in the sense that maybe you rarely have a surgeon who work in two different continents and then, operated on all different ethnicities. So that's why in terms of breast augmentation, I do many different techniques than most of the surgeons here. So these we can go into more detail later on, but that's a cool thing about sort of my experiences.
Yeah. So I'm curious, if somebody comes to you and for a consultation and they just are saying, hey, I would really like my breast to be larger, where do you start with the whole process?
Yeah, that's a very good question, because I always I want them to have a realistic expectation. Also, my ideas are, I think the best sort of cosmetic surgery is something that looks significantly changed but looks natural still. So I personally don't like a very, very small friend and very, very big breast, that kind of look. I like a more natural look. So I typically start with, asking them what kind of bra they typically wear, what cups do they usually wear. I would say probably more than 80% of the patients who come to me are because they wear like an A-cup size bra. And then I would say majority of the women, they answer they want to be somewhere around the C, maybe C/D-ish, because C cup usually gives women enough volume to wear a nice dress without bra and anything, but it's not too big either.
Yeah.
So and then everything is also cultural. So like in New York, there's a study in plastic surgery. It's kind of interesting. In New York, the average breast implant size is smaller than the average breast implant size in California. Because the California has that sort of, Baywatch look, a Hollywood kind of thing. The average bra, the implant size is a little bit larger. And New York, I think is, East Coast more like more natural look. Mm-hmm. So typically, on average, the implant size is a little bit smaller. So that the conversation I start with usually is like, what size do you want to be, and then we have I usually have two ways to help them choose size. We have like the implant sample like this. I have this like a sample implant here to kind of show them of very different sizes, so they can kind of put it in their bra and see, like say 200cc implant, what kind of increase it will look like in a clothing. And then we also have a 3D simulation kind of camera tool that can take a picture of the patient's body and then form a 3D 3D model, and then with the 3D model, you can see, oh, if we put 200 cc, 300 cc implant, what it will look like. So yeah.
I have a question about cc's. So is that cubic centimeters?
Yeah.
And then how does that equate to cup sizes?
Yeah, so that's a very good question, Rainy. So the cup size is a very abstract idea, actually, in general, because I mean, as a lady, you know, if you go to, say, Victoria's Secret, if you go to, you know, different name brand bra shop, you might be wearing different size. Yeah. So, but in plastic surgery, we say usually 1 cup increase about 150 to 200 cc. That's about 1 cup increase, you know, more or less. And then it's 1 cubic centimeter is 1 cc, or, you know, 1 cc is the same as 1 milliliter. It's exactly the same. Yeah.
Okay.
Just a different unit people use. Yeah.
Okay, and the implant that you held up, can you explain the difference between saline and silicone, and you know, what options is a patient given when they come in?
Yeah, that's a very good question, because everyone kind of asks the same question, you know. So this in my hand is a silicone implant. So silicone implant has been sort of the most popular implant to use in the recent years. I would say over 90% of patients, after feeling the saline implant and the silicone implant, they will choose the silicone implant, because silicone implant feels softer. It's like a jelly kind of feeling, versus a saline implant. It will feel like, I'm sure everyone kind of play with water balloon before, you know, it's saline, it's water, you know, it feels more watery.
Yeah.
So, but each implant has pros and cons, you know, that there's no, you know, perfect solution. So most people pick silicone implant for the feel. Okay, some people pick saline implant because they worry if this rupture, and then if the material inside leaks. And then saline is a sort of safer material. If it leaks, and it's just saline, you know, it gets absorbed by your body, and then no harm. But then if this leaks, then it's okay. It's not the end of the world. It's just that you will have some reaction called capsule contracture, meaning your breast become kind of hard, you know, if the silicone leaks. You know, there's a certain rate of how this happen. You know, it depends on different manufacturer and stuff. But I think most people in the end, they pick silicone because of the feel. You know, yeah. But if you are someone who has relatively thick sort of breast tissue, you know, picking a saline implant wouldn't be a problem, because the thick breast tissue will kind of cover that saline kind of feel inside, so you will still have a pretty good feeling even if you pick saline implant. Yeah.
Okay. And what about gummy bear? Because I feel like that's a term that we hear often.
Yeah, so gummy bear is just a newer generation of silicone implants. You know, in the old time, the silicone implant, if you cut them open, they come out like a liquid, like a watery kind of silicone. So that the newer type of silicone, the gummy bear, if you cut them, they don't leak out. They're more like, I guess, like, you know, those mouse pads. You have a mouse pad, like a little jelly thing. It's not exactly the same, but it's like basically you cut it, it won't leak out. It's still like a jelly kind of consistency. So those are so-called the gummy bear implant. And gummy bear implant is more popular these days because if there's less leakage, less silicone flowing out, there's less chance for the so-called capsule contracture. Yeah.
Right. I've seen, we had a breast implant company come to our office a couple years ago, and that was the first time in all these years that I've gotten to feel all the different implants and squeeze them. And it was such an interesting, you know, like demo for them to do, because we write about these topics all the time. And, you know, I personally don't have breast implants. So if you haven't been in a consultation room, you probably have not felt different implants. But it's a really interesting experience, and I was glad that I got to do that. It really helped put everything into perspective for me. Can we also talk, we actually have a question here from someone watching. Is there a lifespan for saline implants? Should you have them redone within 10 to 20 years?
Yeah, that's also a question that I get asked all the time, actually. So, you know, a lot of people come in, doesn't matter whether they pick saline or silicone, they always ask me, oh, Dr. Lau, do I have to change it every 10 years? You know, that's true and not true. You know, any implant is man-made material, like your TV, you know, so no one is going to know when it's going to break down.
Right.
You know, no one. Okay, no one's know. But the thing is, it's just like your TV. If it doesn't break down, you don't need to change it. So like you could keep watching your TV. Just like so any implants you can keep using it as long as there's no problem. So there's actually not a real like timeline. Say, oh, okay, I have no problem, but it's 10 years now. Do I need to change to a new one? No, we don't do that.
Yeah.
Actually, only if you have problem. Like if you have a problem like 3 years after you had surgery, you got to change it.
Right.
So yeah. So but if you have no problem, even if it's 10 year, 20 year, 30 year, you don't need to change it.
Yeah.
Yeah.
And breast implants are some of the most, right, you can correct me if I'm wrong, but studied, it's this very well studied like device or whatever they call the implant in terms of the medical community. Like it is a very safe procedure and a safe thing to have in your body. But you can't predict, what's going to happen with certain people's bodies and how they're going to react, right?
Yeah, that's totally correct. So like you said, a breast implant has been studied by FDA and many different companies all the time. There are many papers. You can even Google Scholar it and you find so many papers on breast implant. And then like a lot of people worry, oh, is it your squeeze is gonna pop or anything like that? I'm squeezing pretty hard, as you can see. They have no problem. So the most common reason for people who need secondary breast surgery, like a second time breast surgery, usually is about two reasons. One is a size change, but that can be totally avoided if you have a good communication with your doctor. Then pick the right size for you. Then you don't have to go back to surgery and just to change to a different one. And the other reason is what I was talking about, the capsule contracture.
Right.
Capsule contracture is just to explain a little bit, it's a phenomenon that whenever you have a foreign body, like an implant, breast implant, or even nose implant, cheek implant, whatever implant that goes in your body naturally forms a capsule, like a tissue around it. And then this capsule is normally soft. You don't feel it. But with certain conditions like inflammation, infection, or if it ruptured, like silicone leaks out, this capsule hardens and becomes very thick and hard. So that's when you have the breast feeling like, oh, very hard. And if that happens, then you have to just surgery go in to remove the capsule and then replace the implant, just put a new one in. So those two are the most common reason for people who might need secondary breast surgery. And I guess the chance of capsule contracture happening, there's various paper quoting different number, but I would say it's about 8 to 10% in the first 10 to 20 years. Okay. So it's acceptable, but it's not like crazy high, but there is always a risk. It's just like any other surgery. There's always risk, of a foreign body.
So we have Julie's writing in here. She said, I had mine done in 2006, no issues, but after kids, I want them redone. Is this something that you hear from patients after they have kids?
Yeah, because after you have kids, it's the hormone changes and also breastfeeding. The breast undergoes many different changes. When you breastfeed, your breast get expanded so much, because of the milk, and then the skin also gets stretched. But then after you finish breastfeeding, the skin's already stretched, but the milk is no longer there, so it becomes more saggy a lot of times. So it really depends. I can't really know exactly what surgery she would need unless I see her. But basically, if it's droopy, then you might need to do some kind of lift at the same time with an implant, or if it's just slightly droopy, just deflated on the upper pole, which a lot of ladies after having kids, the upper pole becomes very deflated. Then maybe all you need is a bigger implant, swap out the old implant and put a bigger implant in. So really depends on each individual person's sort of phenotype.
Yeah. And that leads me to my next question, which is about placement of the implants. So most surgeons place the implants under the muscle, correct?
Yeah.
And what about if somebody has a really muscular build? How do you approach that patient?
Yeah. So there are different school of thoughts for sure. I personally most of my implants under the muscle, or something called dual plane, meaning the top half is under the muscle, bottom half is under breast implant. It gives you a sort of a natural slope on the top, and then also decrease the chance of that capsule contracture I was talking about when you put it under the muscle.
Right.
But for people who are like professional bodybuilder, those are the people that would probably suggest to put it above the muscle just to avoid something called the animation deformity. So it's when you put it under muscle and when you like forcefully trying to squeeze your muscle, and then the implant can move under the muscle. Yeah,
Wow.
yeah. So there are several ways of solving it. You can put it, like I said, above the muscle, or you can also denervate the muscle, meaning you can sort of make the muscle, you can sort of cut the nerve sometimes of the muscle. Where I don't do it, but I know there are people who routinely cut the muscle of the pec muscle, the nerve to the pec muscle, so they don't have this animation deformity.
Okay.
Yeah.
Okay. What about people who are very thin and want a large implant?
Mm-hmm.
And I know, with some, like, people in Hollywood and such that are very on display in the media, you've seen like that ridge at the top of the breast.
Yeah.
How do you avoid that?
So putting it under muscle is one way to avoid it. And then for really, really thin people, you can also do something we call composite breast aug. You can put an implant in, and you can also put some fat grafting on the top of your breast to decrease that contour look. So, it's just to fill in. You can suction a little bit fat from, say, your belly, and then you can fat graft it, put it on top of your breast to smooth that contour a little bit.
Okay.
Yeah.
And is that fat injected in afterwards?
Yeah, it's injection. So all you need is a needle hole and then inject it. And then typically I harvest fat from either the abdomen or the inner thigh, where most ladies have some extra fat to donate. And then the thing about fat grafting is you have to understand, like, not every single fat you put will survive. Mm-hmm. So probably I typically tell them a very conservative number, about probably 50% of the fat we inject will survive. Meaning, like, say we inject, say, 100 cc. So after a while, probably only 50 cc or so will survive, but whatever survives will last forever, So that's the cool thing about fat grafting. That's why some people now, they also do just fat grafting for breast augmentation too. That's also an option. Yeah.
Yeah. No, I think the future of fat transfer is very promising and very interesting.
Yeah.
So if anyone's listening and wants to learn more about that, we definitely have some amazing articles on newbeauty.com. Yeah. You can also reach out to Dr. Lau for more information. But that is a whole nother segment in itself.
Yeah,
so
yeah.
we will get to that in the future. I'm curious if you can take us through the actual surgery. Like, how long does it last and what does the recovery look like?
Yeah. So it also depends on which incision you want to pick. There's usually 3 incision choices, basically meaning where you want the scar to be. One is you can put it under the armpit, which I do using under endoscope. So you can hide the incision under your armpit in one of the creases. Like, we all have multiple creases in our armpit. I would just pick one to go in. And the most common one in the United States, under the breast, the so-called IMF, the inframammary incision, just right underneath the breast. So each procedure, I would say, every surgeon has a different speed. Typically, it takes about between an hour to 2 hours. The surgery is usually under general anesthesia. That means you go to sleep, and then the surgery is done. You wake up, everything's done. And then most patients don't complain, at least in my practice, don't complain a lot of pain. They complain more of tightness. It's because, let's say, your skin originally can only tolerate like an A cup, and all of a sudden you increase it to a C cup. So they feel a lot of tightness in the breast. Probably the first 2 or 3 days, the most kind of difficult period, because the tightness and everything, maybe a little bit pain too. But we always give some pain medication to go home. And then after the first 2 or 3 days, most people feel okay. They still definitely will feel a little bit of pain here and there. And then typically by 1 week, they feel pretty good, And pain is such a subjective thing. I have patients who like went out and eat dinner the same day after surgery. Yeah. Like, I have a patient, and then I was a patient who was like, in pain in like 2 or 3 days, still in a lot of pain.
Yeah.
Yeah.
What about swelling and kind of seeing the final result in terms of your breast settling into the position they're going to remain at?
Yeah, that's a good question. Initially, a lot of times they will look very full on the top, or maybe it looks a little bit too high because the muscle is swollen, the pec muscle is swollen. So a lot of time we can start a patient with doing some kind of massage, and that will help this implant slowly settle down into a more teardrop shape. And usually that process takes about between a month to 2 months. And then you'll slowly see the changes every week. Yeah. That's typical. Yeah, typically, I would say your final result is probably 1 or 2 months after breast surgery.
Okay,
Yeah.
so if somebody is considering breast augmentation with implants for, not for specifically like a large event or a wedding or something, but if that was something that they had desired, how long in advance should they schedule that?
So if they're gonna wear, if they're gonna wear some kind of clothes that has a lot of upper pole fullness, maybe actually the initial swelling will look maybe even fuller. But then if they're just, I think if you want to be safe and make sure you don't have a lot of pain, probably at least 1 or 2 weeks.
Okay.
Yeah, give yourself 1 or 2 weeks. Yeah, because pain again is so subjective. I
Right.
think every patient knows what their pain tolerance or threshold is.
Yeah.
If you're like a very sensitive person, always in a lot of pain, scared of needle or something like that, maybe you give yourself a month. Then,
Yeah.
yeah,
That
just to
makes sense.
yeah, right.
And you mentioned earlier we were talking about breastfeeding. So can you breastfeed with implants, and how is that impacted at all?
Yeah, that's also a great question because everyone also asks that because there are also typically two populations that come for breast augmentation. One is very young lady, 20-something-year-old, but kind of natural flat chest. And then the other population is the moms, and then with the deflation. So this question always gets asked by the younger lady who are still single, not married yet. And then the answer is no problem, because this has been extensively studied by plastic surgery, the academic plastic surgery, I would say I think it's probably even 98 or 99% of people after breast implant can still breastfeed normally.
Okay.
Yeah, but that's not a problem because there are so many layers. Let's say you have the skin layer, the breast gland layer, and then you have the muscle layer, and then the implant.
Right.
So there are many things in between the breast gland and then the implant, at least the muscle in between, if you put it under the muscle. So, and then also another question that kind of follow this, a lot of people ask is, does it cause any cancer? Or any cancer detection or something? This also has been, greatly studied that having an implant doesn't inhibit you from cancer detection. And then there's so many image modality now, like MRI, ultrasound and all kinds of stuff. So a good radiologist can always tell any kind of breast sickness or disease, from the normal breast with or without implants. Yeah.
That's what I was going to ask you next, actually, was about mammograms. So you answered the question.
Yeah. It's okay. But typically, we usually recommend, if you have any question, MRI is always a better image choice after you have an implant. Yeah.
Okay.
But people can still do mammogram. There are people who still do yearly mammogram with implants. No problem. Yeah.
Okay. And what about the size of the nipple? Because I know that I've heard this question before. When you're doing a breast aug with implants or just any type of breast aug, can you manipulate the size of the nipple to better match the new breast, or just if the patient wanted that?
Yeah. So in that mom population, a lot of time when they do breast augmentation, they also want to do a nipple reduction at the same time, because after breastfeeding, maybe 3 kids or something, their nipple become really large, and then a very large nipple is aesthetically not as pleasing. So yeah, it's quite common. Sometimes I do breast augmentation with a nipple reduction, and in fact, last week I did a breast augmentation with a nipple inversion correction. Like, some people in the population, their nipple is inverted, like it doesn't come out. It's just always inside. So this can also be corrected. So reduction, inversion, correction is all very easy to do. I have never had a request for nipple enlargement. I don't think I just never had one, but if anyone asks, I might, I don't know, do a little fat grafting or something. I never had a person ask for nipple enlargement yet.
Yeah.
So, yeah.
But does it affect like the sensation to the nipple or anything like that? Any of these procedures?
Yeah, it can initially.
Okay.
Because your nerve kind of travels in the breast tissue and in the skin to go to the nipple to provide sensation. So when you put an implant in, you stretch the skin a lot and you stretch the breast tissue a lot. So your nipple sensation can be more sensitive or less sensitive in the first 3 to 6 months. And that's all normal. and then typically it all return to normal. But then don't be too alarmed if in the first like a month or two, it feels kind of very sensitive or even not sensitive. It's kind of possible. It's very commonly seen actually because the nerves are kind of stretched. Yeah.
Okay.
Right.
And what about, now we're hearing a lot about this term explant surgery and women wanting their implants removed for various reasons, but one of them just being that they want smaller, more natural looking breasts.
Yeah.
So are you performing these procedures more often now?
I have some patients definitely want their implants out after, they had it for like 10, 20 years. Maybe they had it when they were, in the first popping when they're in the 20s. And then now they're like 40, 50s. Their kids all grown. They don't care to have implants anymore. But it's still few. Okay. I think more people putting them in than taking them out, unless they have a problem. So sometimes they have implant that was placed like, I don't know, 20, 30 years ago, and it was kind of hard now, like the so-called capsule contracture. Okay. And then those people will come and have it removed. But the more likely scenario is they want them to remove or replace with another implant. Because they're kind of used to having a larger breast, after so many years. So if you all of a sudden just take them out, they become a smaller and a little bit droopy breast. And most ladies don't really want that, Okay. Yeah.
And are there any other innovations in breast surgery or implants or things that our audience should know about that are happening right now?
Yeah, there is another implant which is not FDA available in the US yet, but it's actually very popular in Europe, South America, and even Asia. Is something called, I'm not promoting any brand, but let's call Motiva. It has a sort of nano texture on it. So supposedly that can decrease the chance of capsule contracture. But so far it's not FDA approved yet in the United States, so it's not available to be used. And then also, I think there's also inside, there's like a little chip too. They actually put like a microchip inside the implant. So you, with some kind of scanning device, without taking it out, you can read or what size of implant it was, when it was put in, what's the make of it and all that kind of stuff. It's kind of cool. It's kind of cool. Yeah.
That is neat. And there's also an implant registry now, right? For people that they can register their implants just in case there are any issues in the future.
Yeah. Okay. Yeah. I think it's mostly through the FDA and also combination effort with ASPS, the American Society of Plastic Surgery. You can register these implant, but every implant we put in, we also keep a very clear, like a very detailed record of when it was put in, and also exact the serial number. Yeah. Just like a TV, really, it's like a serial number, the maker, and then what size of the implant is, and then every patient goes home with a warranty card too. Wow. It's like a TV, like warranty card with those information on it too, so they all know. Yeah. Okay. Yeah. Wonderful. Well, thank you so much. Is there anything else that you wanted to share on this topic that I left out? Not really. I guess when I didn't realize when I was younger how much breast implant can actually change someone's confidence, actually, until I get a little bit older, because I always think, breast, it's, as long as you have one, it's good. But then after I met a few of my patients, like I have some 18-year-old patient who have a very, very flat breast, like very, very flat, almost like a guy, and that really affects her confidence. Yeah. And she was always afraid to go to swimming pool and then she have to wear a lot of padded clothes, and then she also was afraid to get a boyfriend and all that kind of, and she was going to college. Actually, her mom brought her in, her mom brought her in, and then we did a very natural size breast augmentation, and afterwards, you can tell she's just like a different person, like much more confident. And then also she came back for her like 3 or 4 year follow-up, and she had a very happy college life. Everything's normal. It's just everyone wants to look. Yeah. I don't think everyone should look the same, but then when someone is look very different from everyone else, they feel singled out, they get picked out. So the cosmetic surgery can help them restore that confidence, which I think is helpful. Yeah.
Yeah, and that's our mission at New Beauty too, is you know, breast augmentation and breast implants and breast surgery in general is not for everyone, but it can really, really change someone's life. And if it's something that is going to make you feel more empowered and more confident, then we are all for it. And I know that you feel the same way. And we're very lucky to partner with people like you who can help spread that message and help women achieve their goals. So thank you so much. I hope you have a great weekend, and we'll be saving this live on our New Beauty feed. So if anybody missed it and wants to refer back, go ahead and find it there. And our new fall issue of the magazine will be coming out next week. So stay tuned for that. We have Beth Bears on our cover, which is fantastic. And yes, all good things to come. So thank you so much.
Thank you, Brittany. It's my pleasure.
Talk soon.
Thank you.
Bye, everyone.
Bye.